A Doctors Without Borders nurse whose quarantine sparked a flurry of arguments between herself, the state of New Jersey, and federal officials has been discharged with plans to self-quarantine in Maine. But Casey Hickok's situation ushered in the need for new guidelines on how healthcare workers and other travelers coming from West Africa should be monitored for signs of Ebola. The guidelines issued by the CDC Monday individualize recommendations for travelers based on a person's level of risk. People determined high risk, for example, wouldn't be able to use public transportation for 21 days and would be told not to go to work. On the other end of the spectrum, low-risk people would simply have to self-monitor their temperature and symptoms. However, the recommendations are just that, recommendations.
But ultimately, it's the responsibility. In fact, the authority is vested with state and local officials to make decisions about how best to protect their citizens.
In Atlanta, for example, anyone arriving at the world's busiest airport from the 3 Ebola-affected countries who have been in contact with Ebola patients will be quarantined for 21 days, even if the travelers do not show any symptoms.
They have had exposure to known Ebola virus, that I think that is the kind of precautions that are justified under the circumstances.
So, under those Georgia guidelines, health workers would be quarantined at their homes and be monitored directly twice a day by someone with the State Department of Public Health for 21 days. If the reaction to New Jersey's quarantine of Hickox is any indication, the Obama administration would likely view this as being over-restrictive.
I think this story has resonated with the federal government, and they're concerned about states really overreaching here.
Those mixed messages could be confusing to the public, and Celine Gounder, an infectious disease and public health specialist, told CNN it also influences medical professionals who may have volunteered in West Africa.
This is really going to prevent some people from volunteering. We're already having difficulty recruiting healthcare workers to go over.
And the White House says that is crucial in the fight against Ebola.
Stopping this Ebola outbreak in its tracks in West Africa is critically important to our national security and to the safety and health of American citizens.